Pinnella of South Florida Center for Cosmetic Surgery, and I've been practicing cosmetic surgery for 40 years. Plastic surgery is an art form, and in fact I was an art major in college. I intended to have a career in art, but I also excelled in science, so I got a full scholarship to medical school. So I thought, well, combine art and science and be a plastic surgeon. So my passion is to create beauty, and by creating beauty for people, to help them have a happier life. Now, who's a candidate for cosmetic surgery? Well, anybody from basically teen years up to the elderly can have cosmetic surgery if they have a specific concern and if their health permits it. Ideally, cosmetic surgery should be done on somebody that is already in fairly good health or has any health conditions controlled by their medical doctor. Now, the BMI, the body mass index, that's the relationship of the height to your weight. If you're too heavy, that creates increased risk for any kind of procedure. So we like to have control of the weight before having surgery. In some cases that's not possible, but then we have to take special precautions in those particular cases. The Brazilian butt lift has been a popular procedure in recent years. It's basically a fat transfer from areas where you don't want the fat and placing that fat in the buttocks to create better buttock shape and size. Usually we take fat out of the abdomen and back, sometimes the thighs and arms, and then transfer that fat to the buttocks. That creates a nice recontouring of the entire body. One of the advantages of that is there's not much cutting involved. There's only a few small nicks in the skin. We use a cannula, which is a tube, and place it under the skin where we want to extract fat, and then we inject it into the buttocks. So the recovery is fairly fast. This procedure is popular because it can be done as an outpatient procedure, and there are no real restrictions on activity, except we don't like you sitting on your butt for about a week. So most people take a week off of work and then return to their normal activities. Now for the abdomen, there's tummy tuck or abdominoplasty versus liposuction or fat extraction. Now liposuction is the simpler procedure because there's not much cutting. A few little nicks in the skin, put a tube under the skin and suction fat out. So that can create a dramatic change in body contour, but it only removes fat. It does not tighten skin or muscle. So if, for instance, you're a woman that has had 2 or 3 children and the skin is relaxed and the muscles are stretched out, or there's an overhang of the abdomen, then a tummy tuck is going to be more appropriate. Now some procedures can be combined, like for instance with a tummy tuck, we often liposuction the flanks or the sides to help blend in the tummy to the back and create a narrower waistline. But it's not realistic to do a tummy tuck at the same time as a Brazilian butt lift. For a Brazilian butt lift, we need quite a bit of fat in order to make a significant difference. And with a tummy tuck, we only can extract a limited amount of fat. Now there's a so-called mommy makeover. That's basically for women that have had some children, and they're finished having children, but that has taken a toll on their bodies. Their abdomen can be stretched out, their breasts may be sagging, and they need a combination of procedures. It could be just a breast lift or breast reduction, or a breast lift with implants, depending on what their situation is. That can be combined with a tummy tuck at the same time, and to give an overall mommy makeover, or return hopefully back to the body shape before you had children. Now some people ask about a mini tummy tuck. In general, any mini procedure gives a mini result. So if you have a big overhang of the abdomen and you want a mini tummy tuck, that's not realistic. But if you just have a little bit of looseness or relaxation and you're not looking for too dramatic a procedure, a mini tummy tuck may be appropriate. Usually we do the full tummy tuck. A facelift can be done on anybody who has relaxation of the face. Customarily, we start seeing people requesting facelifts at age 45 or older. That's the typical classical facelift age. But some people that perhaps lost a lot of weight may have facial relaxation at a younger age, in which case then a facelift would be appropriate. Patients often ask about lymphatic drainage massage. Massage is always helpful for circulation and for helping swelling go down. For some procedures, however, the patient may be a little bit too sore for the first week to have aggressive massages. Now, even without massages, you will recover, but massages can be helpful to help the circulation and the swelling. Now, plastic surgery is to try to have a better look and to stay looking better. Part of looking good is being healthy. So if you're going to just go through the procedure of a cosmetic surgery, you should also look at your lifestyle and moderate any bad habits you may have. Cookies and candy, excessive alcohol, smoking, other factors that may affect your weight or your general health, because always a healthier person tends to look better than an unhealthy person. So you want to stay healthy. Now, how to prepare for plastic surgery? Well, if you have active medical conditions, it would be reasonable to get your general medical physician to go over your condition and make sure that everything is stable and that you're fit for a cosmetic procedure. Generally, cosmetic procedures are well tolerated because we operate on people that are not sick. So preparing for plastic surgery means cutting back on any bad habits like smoking or excessive drinking, having good physical hygiene, showering, staying clean, and that's about it. So, if you're thinking you want more information, you can contact our website or call us and or text us pictures. You can do a virtual consultation, you can speak to the physician, and you can make your decision that way.